Hello friends, we will discuss about basic information of first aid and managements of difference. First aid steps which we adopt during first aid of the casualty in case of any emergency. Definition of first aid. First aid refers to the immediate and initial care given to a person who has been injured or suddenly becomes ill. It is the provision of basic medical assistance or treatment provided to stabilize the victim's condition until professional medical help can be obtained. The primary goals of first aid: 1. Preserve life. 2. Prevent the condition from worsening. 3. Promote recovery. First aid management. 1. Assessment of the scene and safety. 2. Primary assessment, ABC. 3. Activate emergency medical services, EMS. 4. Provide initial care. 5. Secondary assessment. 6. Specific first aid interventions. 7. Comfort and reassurance. 8. Documentation and handover. Assessment of the scene and safety. 1. Ensure personal safety and assess the scene for potential dangers. 2. Check for hazards such as fire, traffic, or toxic substances. 3. Assess the condition of the victim and determine the appropriate actions to take. Primary assessment, ABC. Check the victim's airway, breathing, and circulation, ABC. Airway. Ensure the airway is clear by gently tilting the head back and lifting the chin. Breathing. Look, listen, and feel for signs of breathing. Circulation. Check for signs of circulation such as pulse, coughing, or movement. Activate emergency medical services, EMS. Call for professional medical assistance by dialing the emergency number, EGG 911. Provide essential information about the victim's condition, location, and any hazards present. Provide initial care. Attend to any life-threatening conditions immediately, such as performing CPR for cardiac arrest or clearing an obstructed airway. Control severe bleeding by applying direct pressure to the wound. Immobilize suspected fractures or spinal injuries to prevent further damage. Secondary assessment. Conduct a more detailed assessment of the victim's injuries or medical condition. PSI. Obtain information about the victim's medical history, allergies, and current medications if possible. 3. Assess for any additional injuries or symptoms that may require intervention. Specific first aid interventions. Provide appropriate treatment for specific injuries or illnesses. Choking. Perform abdominal thrusts, Heimlich maneuver, for conscious choking victims. Burns. Cool the burn with cool running water and cover with a clean, dry dressing. Sprains and strains. Apply ice packs and elevate the injured limb to reduce swelling. Poisoning. Remove the victim from the source of poison and contact a poison control center for guidance. Heat-related illnesses. Move the victim to a cool place. Offer fluids and apply cold compresses. Comfort and reassurance. Stay with the victim and provide comfort and reassurance. Keep the victim calm and encourage them to remain still until help arrives. Offer emotional support to both the victim and any bystanders involved. Documentation and handover. Keep a record of the first aid provided, including details of injuries, treatments given, and the victim's response. Provide a thorough handover to emergency medical responders when they arrive, including relevant information about the victim's condition and any interventions performed. Friends, we will meet in next lecture. Very soon, your feedback is very important and valuable for me. Please subscribe my channel so that my next lecture is available for you for your guidance and knowledge.